This book is The Library of Health. It was published in 1920, and I was hoping it would have information about the 1918 influenza pandemic. That pandemic killed 50 million people, or 1/3 of the world's population. There are stories of entire families dying in a single day. There's no mention of influenza in here because it took 4 years for a book to go from a finished manuscript to a published work. The fact that it doesn't mention influenza illustrates how blindsided the world was by this pandemic. The treatments for infections in this book are Dover's powder, mercury, foot baths, and a multitude of other things that didn't work very well. Penicillin wasn't discovered by Sir Andrew Fleming until 1928, and there were no good treatments for bacterial infections in this book. This machine is simply named Lightning. There are no directions with it, and it clearly uses electricity. The setting for carcinoma, or cancer, is from 1 to 20. The setting for general poison is 11 to 50. The setting for acid in joints is 1 to 10. The setting for vitality is 60 to 350. I can imagine some of these treatments were painful, and anyone investing in a machine like this no doubt used it often. There are treatments that have been in use for millennia and are still in use. Acupuncture and many forms of traditional medicine are still valid treatments. Sham treatments like the Lightning machine are no longer in use because they didn't work, and many were downright dangerous. Medicine has come a long way in the last 100 years. Life expectancy for men in 1920 was 58.8 years, and for women was 60.6 years. Life expectancy as of 2011 is extended more than 20 years at 79.3 years for men and 83.6 years for women. In the early 20th century, approximately 100 out of every 1,000 live births died by the age of 1 year. By 1997, that rate dropped to 7.9. The reason behind these advances is science and the establishment of public health. Better environmental standards, safe drinking water, vaccines, antibiotics, car seats, helmets, and any number of interventions has bettered our standard of living. Understanding cell biology has allowed remarkable strides in medicine and the diagnosis and treatment of disease. Diagnostic imaging is nothing short of amazing. It's been said, an ounce of prevention is worth a pound of cure. That still holds. In spite of our advances in technology, clean air, clean water, exercise, good relationships, and taking care of ourselves and our loved ones are still the most important contributors to long and healthy lives. As always, talk with your healthcare provider, and remember to call an elder. They've been waiting for your call. I'm Dr. Arne Vainio, and this is Health Matters.